Is there any questions from the floor about that?
You're saying the younger people show less signs of CCSVR, and does that not point to multiple sclerosis causing CCSVR? If these younger people don't show signs of
Could you repeat your question?
You were saying the younger people don't show as much signs of CCSVR.
No.
Is that right?
No. No, just all. Just all.
I also have a question.
Yeah.
The question is normally comes from a lot of people. Is it the severe cases of severe cases in terms of mobility that you see most improvement through the treatment, where there is restrictions? Or is it more lasting in the people with less severe?
So we see two different groups of the patient regarding the problems with mobility. First is a patient in whom the mobility problems related to spasticity and so on, weak legs, and in general those patients don't improve after endovascular treatment. Other group has strong legs, however cannot walk because of problem with balance, and usually this patient improve. So those patients who come to the hospital on wheelchair and walk afterwards are those patients with balance problem, not weak or spastic legs. Of course, we don't know whether this spasticity or weak legs maybe it will improve in a long-term perspective, but in short term they do not improve.
In that group that you mentioned, you have strong legs, good balance. Do they, in this 95% cases, show restrictions?
Yes.
Yeah. Then that correlation. Right.
And this is a similar problem.
Okay, one last question, Marian.
Do you have to break down, you had the MS Quality of Life survey showing improvements. Do you have a breakdown of what improvements, what type of improvements people had? And also, do you have information on how long they sustained the improvements for?
So as I said, that our first operation was on October last year. So we have no long-term observations, sorry.
Do you have a breakdown of, on that quality of life survey, which were the type of symptoms which improved?
Okay, so these symptoms which usually improve is the problems with bladder function, problem with balance, so all this ataxia, nystagmus. On the contrary, usually walking, it is not relating to the balance problem, do not improve. Regarding vision, also there are two groups of patients. First, with optic nerve lesions, and they do not improve, and the patient develops rather healthy eyes, but they cannot see properly due to nystagmus, this uncontrolled eye movements. And those patients very often improve after the procedure. It's very similar to walking.
So that was the same for neuralgia. So because
Not, we think that the mechanism is different. Because the improvement is present, is very rapid, and at least theoretically it cannot be related to some sort of degeneration of nerves and so on. It must be something different. But what? We don't know.
So if you've got neuralgia,
we have only a few patients with these symptoms, and some of them improve, some do not, but due to rather small groups, we have no good statistics for it.